All right, so the last question is, says, "Hi doctor, my son is 14 years old and his front tooth is broken. My dentist suggested extracting it and getting an implant. I'm a little worried it's too early to get an implant since he's still growing. What is the right age for getting an implant?"
A great question. So this is one
Absolutely.
of the most common questions that asked by the parents, and particularly with a lot of sports injury happens, on some of the kids when they're playing sports and they lost the tooth at an early age, or some kids when they are going through braces and the teeth never came in. So it's one of the common questions people ask. So the right age for the kids to have the dental implants is after they finish growing. So for some kids, the depending on the kid, when do they finish growing, it may differ. Generally, we say the uh, the right age for the girls is about 14 or 15 when they stop growing, and for the boys, like maybe around like 16 or 17 when they completely stop growing. So when the parents bring them here for treatment of either a missing tooth or the tooth that got broken, so we ask them, one of the most common questions that I ask them, hey, are you still changing your shoe size? Are you still changing your clothes sizes? So when they do, that means they are growing, particularly the shoe size. So then we tell them, hey, wait until you finish completely growing, then we can do the implant. Again, same thing with the boys too. So we always tell them, once you stop completely growing, then we will do the implant placement. So one of the common question that asked is, hey, what do I do in the meantime? So to prevent the tooth movement, because anytime you have a missing tooth, the teeth will start shifting. That's one of the main reasons why we do dental implants, right? So what we normally tell them during that time is what we call it as a retainer. So we call it as a retainer or like a braces. So it is like a clear retainer like this. So you wear them on the tooth, like see here, for example, in this one, this patient had a missing tooth in the front. So this patient is going to wear this as a retainer to retain, just like the word it sounds, it's going to retain the space. So once you finish growing, then we are going to replace the tooth with a dental implant.
Absolutely.